Browsing around looking for something educative and fun to watch? Or are you health conscious? Then welcome to Vodafone Healthline. We've got the best of both worlds. Coming up, we have a baby battling brain tumor, a specialist explaining erectile disorders, and our two constant doctors unraveling health myths. I'm Frema Asiedu. This show is proudly sponsored by Vodafone. The future is exciting. Ready? Welcome back. We have our regular doctors with us today. Dr. Forson looking very lovely in pink and Dr. Yali in green. Very bright green, by the way.
My wife chose it.
Oh, she knows color. Anyway, what is your take on erectile dysfunction? Do you have any personal stories to share?
I'll leave that to you.
I'm just kidding. You cool off. I'm just kidding. All right, so let's move directly to our Mythbusters. Let's see what social media gave us this time around. Last week I thought it was Asema, but then the Asema but triple. Hey, yo. A doctor from Muzempa, is it? Bemana Diana Yenchaya. Uncircumcised penis reduces the risk of getting HIV/AIDS. Hey. Me see the Muyedru.
And I mean, me down.
Okay, I'll do this for myself and all the men here.
Okay, go boy.
So let's start off with what the factory setting is. When
Factory
the penis
setting.
comes, yes. I mean, here in Ghana, most of us have the circumcised penis, so we don't quite see what the factory setting is, what God gives us.
Okay.
So if you have a little boy, you see that the tip of his penis is not, it's not like, it's normally, it's not smooth.
It's not like a banana.
It's not. It's like something goes off and on. You need to
Okay.
sort of pull the thing down to see. That thing you pull down is known as the foreskin.
Okay.
And that foreskin is sort of supposed to be protective. But over the years with evolution and civilization, religion,
A bit of religion.
you realize that we sort of have moved away from it. Now it has good sides, which I'm sure Dr. Folston will talk about. Oh no, she'll talk about the good side.
I've been coerced into this.
But before that, I'll just explain how we even contract HIV.
Okay.
So HIV is it's a virus, lives in body cells. So the virus sort of needs the body cells to thrive.
Okay.
So when there's a breach in skin, then you get it.
Breaching skins were prana.
Oh, with prayer during intercourse because of the friction, during sex, the penis go in and out of the vagina now. See that the friction sort of, so there's that little source.
Okay.
Exactly. So all these serve as a medium. So anything that gives the virus the opportunity to move from one person who is infected to the other who is not in that medium would give HIV/AIDS. Now, Dr. Folson will tell us why an uncircumcised penis does not.
Oh, Doc.
All right. So since my first man and I just said, "Mister make a big from
Come on, man.
from books, no."
Come on, man. Come on, man.
Okay. So in Ghana, usually, we're more used to the circumcised penis. We're very religious people. So invariably, when a child, a baby boy is born, he gets circumcised. It has advantages, mainly because it's easier to keep it clean. As he was describing the the foreskin. You can tell that there's going to be a bit of a gap between the foreskin and the tip of the penis, which you have to put in a bit more effort to be able to clean up and keep it more hygienic.
That's for one chat.
That is a way in chat. Exactly. Because the thing is, foreskin has its own function. It produces a lot of fluids, which is supposed to lubricate the tip of the penis. All right. So as it's producing more of these things, when cleaning it gets kind of stuck in the gutter or the fold in between the tip, and it forms something called smegma, and that predisposes to generally unhygienic, conditions. Dance.
Naturally, no lubrication.
I know.
Man, yes, one infection.
Exactly. Exactly. So the thing is, they have to put in extra effort, to do that. And when you don't do it, you harbor certain particular organisms. In particular, for example, if your partner is uncircumcised and he harbors infections like viruses, typically things like human papilloma virus, which is notorious for causing cervical cancer. So it's been found out that partners of these uncircumcised males may have a slightly increased risk of getting cervical cancer because they might harbor, and also these chronic infections will predispose the man himself to getting penile inflammation, chronic inflammation, leading to some kind of cancers. So by default, I think what we do in Ghana is not bad. I mean, by default, we circumcise, and it's not a bad thing.
By default.
But it's really a matter of preference. If you're uncircumcised and you keep it nice and clean.
Can you say and dry?
Dry. If you put in effort and you after washing down, if you push the prepuce back and you clean it up, I think that you should be okay.
See, so by virtue of loose skin, it moves up and down. This skin is liable to ulcerations. Just during intercourse, it's very possible. So it's flabby and it's moving up and down. So they have little tears, little sores. Infections like herpes are more likely to be present in this STD. They are most likely to be present there. Now, when this happens, there'll be ulcerations over the skin. When this happens, like we said, there's a direct transfer of body fluids. You realize that you are opening yourself up a little bit more to HIV transmission if your partner is infected.
Intimate way, absolutely.
Oh, it's a non-starter. It's a non-starter.
Ayo, hey, wait a minute, thank you very much, and we'll be right back. I have a story to tell.
My dad always says, family must stick together. So we found the perfect way to stay connected. We signed up for the Vodafone One Family Package. Now, Grandpa not only stays in touch with his old friends, but has also become a big hit in his social media circles. Mom can now also easily transfer data from our fixed broadband to Kojo's phone, or mine, or Dad's. Kojo can chat,
Sign up today for Vodafone One Family, the first ever total communications package for the family that gives broadband, landline and mobile minutes, SMS and data for up to 4 mobile devices, and choose a package that best fits your family.
A family that stays connected, sticks together.
The future is exciting. Ready?
Moving on. Some children like Dinah start their fight for life very early on. They pay for everything. The breath, they pay for it. To sleep well at night, they pay for it. To smile, they pay for it.
meku ngekere kame cho agbelegboko de vio le kodia de kada peku vinyi epe eta afuma me va po be via jejo ho me pe de koji ova ne atike wono afuma ete vide ta me gbobe na wa ta na wa ta we wa nyu anu we ake o metun ta me gwa ga do mi da hohwe be mi fima ta he mi ya ova pe obe na mi leti eto ne wa po be atike he wono de ato a fian lo awo nde chum metun we ta ova na mi va de photo bele labo ya ova na mi mo be wa operation na de vele hohwe o ye wo pe a o metun yo ta o do mi da de kolebu na me pe de egbo me pe na la be ne menya va yila ama wano nye pe nya agbolo wano bivia pe nya agbolo esi ayila nye me pona vovo dujo me no na nwunye kunwu bivia che no gbogbo be tanka epe ta fuma adu afu wano no via odo akolebu mi vale a over yoga kana mi ta mele pepedo unto tita emi leji wula Vodafone to over hu mi awun pere over pere mi awun bifia ta owo odo anevo pe na mi awe wodo me ku he gbe wa va wodo na le via mi ape ji ma preso nye pe te pe mi ape je no chuchu next de ka kra do vala mi va pe beleke enu ale jojo o gbo na mi be o ele nyonyu ake still la mi ape ji la mele nyonyu na mi o ka mi va po be o va gbo na mi be enu a o wevo ta enyu mi va pe vivi na mi azon enu a mi po jijo de un la be na de keme gale fuma he wo do na de via voa mi du o se da fe pele nkeke ve le kolebu ape o na mi be mi va pe na mi ga trova tu wisi me e fi mi va do a la me se sembli bo va le si ta e kwa ku de vi over le ko di nwede na de keme gale wo e la be la tikeji cheta na de keme gale wo
me di be ba da akpe na Vodafone to me no pom le TV di akegbela nya ha me po iklenku ata mi tu mi ada akpe na o Vodafone to
I wish I could say that Akpe is, I think if I said it right. Vodafone, thank you. And it's very sad and now very touching. You've seen the entire story of Dinah. Honestly, doctors, just a stone. They just threw a stone to hit her head, and this long journey, did the stone trigger something? What is this all about?
So medically, we would call this a red herring, the stone. The stone would be considered a red herring.
And what do you mean by red herring?
So by red herring, it's sort of happened sort of coincidentally, and we're having things being attributed to it. But if we look at what was found intra-op, what the disease is, a stone is very unlikely, highly unlikely to have led to her condition.
So what was found, since you mentioned intra, what of that?
So it was a brain tumor. That's when we say a brain tumor, we mean an abnormal growth inside the brain or involving the brain. Now, this could be an original brain cell, like the cells that are growing abnormally could be original neural cells, that's nervous tissue, brain matter, or they could be a metastasis, so they are coming from somewhere else.
Yeah.
So if there's another malignant, another cancer somewhere, they are coming from there into the brain. Now the issue about this is that when it comes to the brain, it's a closed space.
Okay.
You know, like it feels a little hard. It is hard, except for babies when it's a little malleable and able to move. As we grow, it calcifies, the skull calcifies, and it becomes a fixed space. So anytime there's any growth inside, even as small as my little, my finger is big, let me see. Maybe the tip of your fingernail, maybe. Anytime there's a little growth like that there, it causes what is known as a increase in intracranial pressure.
Okay.
Now, this is what gives us all the signs and symptoms and morbidity that come with brain tumors.
But it's not a stone. So if the stone wasn't thrown, Inka, would the swelling still be there? That's the thing I
think it was a nice intervention by God to get this thing diagnosed. Because really, like Dr. Yali said, the stone is very unlikely to have caused the tumor that was found. So it was something that was there and somehow needed to be picked up, you know, and then this happened, led to the, I'm telling you, because really what I'd like to find out from her, if I ever get to interview her later on, would be, say, were there any of the typical signs that would tell you that there's something going on in the brain? You know, like he said, because the brain is a fixed space, any little change in the volume of something coming to encroach in its fixed space leads to symptoms, and the pressures in the brain go up. So typically, the patient will complain of headaches, of nausea and early morning vomiting. If you've observed the patient long enough, you might notice changes in their behavior, change in speech, change in vision, change in walking. It really depends on which part of the brain has been affected by the tumor. Some children might develop seizures or convulsions. And when the pressures get too high, then they start getting slowly drowsy, unconscious, and then the end is usually not very good. So really, the parents would have to have been very observant, exactly, to have noticed these subtle telltale signs of a raised pressure, of the presence of this tumor in the brain.
You know what is interesting, Dr. Folsen, that she's part of a large family, obviously. She was playing with the other children or her own siblings. And so you know how children like to play. All person when you be are going to say, "Oh, if you cry on tears, on the member fees are grow." The joy to play with their siblings, who I think overshadow her need to say, "Mommy, hi, me." Because on that, everyone bit leaf be so on. So you're right. It takes more. Let's later when we meet them. I'm curious. Perhaps they pick something.
Exactly.
But before surgery, I'm sure being referred to Kolebunu, all the things you were mentioning, looking at the intro that I gave, she had experienced some of these things, breathing, headaches, so sleeping well is even a problem and all that. So perhaps we'll get to see if it happened before all of this.
It'd be good to know.
Yes, it'd be good to know. We'll be right back.
Ma, I'm for phone in your quick call and sawako.
Hey, it would also put a sound network way. I'm more credit in the data fiano.
Oh,
Nick Shin, you don't know what so. What is a Vodafone? A double red 1, red 2, and red 5 offers. Yeah, double into swap up baby. Na 5 cities any day. Jai. Uber Casa 250 minutes. Na data no. And also 250 megabytes. I hear na benya way. I guess a hanko.
Hey, mommy. And aside me finish a corner quick na call.
Hey. Apostle, Ube Jane, and yes, Ube Bressa.
Switch to Vodafone and enjoy double into swap on red bundles of 1, 2, and 5 CDs. Enjoy double talk minutes to call all networks and double data to browse. Vodafone always gives you more. Terms and conditions apply.
Vodafone double into swap the
The future is exciting. Ready?
Welcome back. Remember, this show is proudly sponsored by Vodafone. The future is exciting. Ready? Well, do you know how it feels for a man to know there's some party but he can't show up? Or a woman to actually go to the party and be left alone? We are about to talk about trending male sexual issues. Be unchoke. Na mo sa don ko mi obi obefa bia dwom wo hinfo 1 minute man be gi aduro den. But somehow into me nka ho asem. But Dr. Poyegbede on for real obeka mu nukra nyina a kire ye nne nti enwe yaso. Welcome, doctor.
Thank you.
It's good to see you again.
Thank you.
Doctor, I'm sure people want to hear the Russian one more time.
Okay.
So,
Kak o vas diela.
Hey. So let's
just continue.
Anyway, Doc,
Yes.
erectile disorders, they move from the ED. What is it? And is it just the 1 minute we should be worried about?
So the man was sitting down in his corner thinking about his inability to perform in the night. The woman came to him. I said, you cry, what problem has God given you?
Oh.
Me, the woman, every month I have to have my menses. I have to be pregnant. I have to deliver. And I have to breastfeed. What problem has God given you?
Oh.
So my friend in his corner looked and he said, Madam, the problem that God gave me is the whole of you over there.
Ooh.
So this tells us that erectile problems are not only male problems. It's a teamwork.
Yate.
There are a group of them. And the first and foremost is erectile dysfunction.
Dysfunction.
Dysfunction. The penis is not working.
Hey.
You
Flat.
cannot erect, hold it, and perform the function that is supposed to perform. So it's not working.
Okay.
It can sometimes be weak somehow,
Okay.
but it cannot penetrate. It still cannot perform its function.
And also it's
So that
erectile
is erectile dysfunction. Then another aspect is premature ejaculation.
1 minute man.
So you
Doc.
erect.
And was here. Premature near 1 minute man. Well,
Yes.
okay, I want us to get that.
The definition is that you cannot erect, perform the function more than a minute. So people sometimes, before even the action time, they have ejaculated.
Oh.
It means the penis will go down. Or they erect strong enough, and by the time things are getting ready, within a minute of penetration, it goes down. So there's a problem. Then we might also talk about what we call
Doc,
retrograde ejaculation.
Hold on 1 second. I have to ask this one.
Okay.
We've had 1 minute for so long. You even mentioned the 1 minute. How long should a man last if he can hold? So if 1 minute is too short, what is too long, or what is the normal time frame?
So people on the ground, for reality, not talking about textbook,
Okay.
we want to say that premature ejaculation is an ejaculation at the time that the man and the woman are not satisfied with.
Okay.
But the average should be around 5 minutes.
5 minutes.
5 minutes.
Okay.
But the textbook says if it's more than a minute and you think that it is not good for you, then you know you need a psychological advice. But we will not look there.
We will not look there.
The third group of people with erectile disorder is retrograde ejaculation.
Retrograde.
Now, ejaculation is coming out of the fluid, which we call semen, from the man during sexual acts, or it could be during masturbation. Now, this has nothing to do with orgasm. They are two different things.
Okay.
Now, from the structure of the male genitalia, there is a prostate. The tubes that bring the sperm, they pass through the prostate and come and be at the base of the penis.
Which ran your last episode,
Yes.
no?
So when there is ejaculation, there is a contraction of the muscles of the tube through which we urinate, and it is through the same tube that sperm come out.
Doc, mpacho, where dear Mr. Rewa, mfanche mpanyifo.
Okay, so we
Three.
have this.
Uh-huh.
This is what we call the penis, or you can call it phallus. So during sexual acts, the sperm move from the testes through the tubes and come and be here and be waiting as you are doing.
Here.
Yes, at the base around here.
Okay.
During the enjoyment you'll be doing, then you feel that no, something is about to come. Now what will happen is that the tubes below will contract and push the sperm out or the semen out. That's why we see the forceful coming out of it. But the issue is that the bladder is here. It's also the continuation of that tube we call urethra. It means that it must block, it must tighten up so that the sperm can hit it and come forward for everybody, for the two people to know that, okay, we have reached our ultimate goal.
Normally, no, the sperm, the semen, no, Instead of coming out direct, it goes back.
So this place, for some diseases and for some surgical procedures, especially also the disease of diabetes, this place become weakened. Okay. So when the contraction happen, instead of the entrance of the bladder being closed, is relaxed. So all the sperm, instead of coming out, come inside.
Into the bladder.
Yes. So you have your orgasm. The feeling of the joy will be there, but you might not see semen. So even when it is seen, small amount is seen. Okay. And a lot of people don't like it. Can I tell a story? So an elderly person, 80-year-old, was on a medication to treat his prostate disease. He comes to me, the doctor, I can't see water coming out. Okay. I say, oh, sir, but it's no problem, but your age. Then he asked me that, do I like fufu? I say, yes, fufu is a delicacy for every Ghanaian. He said, so your fufu, can you take it without live soup? I said, no. He said, that's what I'm talking about. So I was forced to treat. So though it's not more like something that will affect your health, people still like it. And those people who do not experience, who experience this, will need to see their doctors. There might be another medical problem which is leading to it. Okay. But I said the most common one is diabetes and some medications used for treatment for prostate diseases. Okay. Is there another type? Then there is another type. That is delay ejaculation. Okay. Oh, you will be having the sexual act, the sperm will not come out. Sometimes it's after more than 30 minutes before it will come out. Now, the problem here is that you might have your orgasm, but if you are a young family, you want to have children, the woman will insist that the sperm comes. Now, it could be on and off. It's not an issue. But if it becomes something that during the sexual act, there is fatigue for both people, or there is irritation, you are no more interested, or because of the long period, there is detumescence, that is, the erection will go down. Or your wife will say, Bonibe ma ye, it's okay, me, I don't want to continue again. I think that is the time you have to go and see your doctor.
But doctor, some people take medications and concoctions. So at 30 minutes now, and they are aiming at that. Two of us are in Rono. And you are now saying that 30 minutes is too long.
More than 30 minutes.
More than 30 minutes.
More than 30 minutes. Hey. And there is no benefit. I mean, the reward of sexual act, especially for young family, is not there. So it's like you are working in vain. So we also have what we call anejaculation.
Kota.
That it won't come.
Wow.
But some, you might have both anejaculation and orgasm. Okay. But some, you might have anejaculation but with orgasm. All depend on the disease processes that are affecting it. So you have the sexual, you have the thinner, nothing will come. And it's also frustrating. And this one, most of the time, it is more of, there is something we call TURP. It's a surgical procedure which they use to treat enlarged prostate. Okay. They actually go through the penis and scrape off the prostate. But after the prostate, the ejaculatory ducts are there. So if the doctor is not careful, he scrape it with them and block it. So it will not come out. Or some surgical procedures have been done for you. Like you have a testicular tumor, they remove the tumor, but they open you and make sure that the tumor cells around are removed. And if the nerves which control the ejaculation are removed, there will be a problem in that case as well.
Doc, if it's not coming out, backlog will it cause problems?
So fortunately or unfortunately for this group of people, they have nocturnal emission. Emission is the sperm comes and maybe during the dream, wet dream, then it will come out. So
when you need it, it won't come.
Yes.
When you are sleeping, no.
That is nature for you. So these are the problems that are supposed to be men's problem. Now, we want to look at some of the problems that lead to some of these ones. But before then, I want to say that aphrodisiac and medications that are used to treat erectile dysfunction are two different things. Okay. Aphrodisiac are liquids or full substances which we take to increase our libido.
And libido, no.
But not.
Doc, not everybody understands libido.
Libido is the edge that you want to have sex. The edge. Anything you see, but you want to fire one. So that is it. Now, but in this country, people sell medications which are supposed to be used for erectile dysfunction to young men who do not need the erectile problem. So, at the end of the day, some take it. Those who are wise, the erection comes and will not go down. Will not go down. We call it priapism.
Wow.
It will be there. Some stay in the room. Then they'll put it inside. 3 days, 4 days, they'll put it inside. The girl will go and buy food and come. It is wrong. If your erection is not going down, please quickly come to the hospital. Because the issue is that when you see this penis, what is inside can be compared to a sponge which is rolled.
Foam. Foam.
No, sponge with the holes inside.
Sapo.
Yes, sponge. The net type.
Okay.
So the spaces inside that sponge are the places that the blood has to fill to give you erection.
Okay.
Now, if the blood goes in and it remains, the penis is a live tissue.
Okay.
It will start taking oxygen from the blood.
Okay.
And at a point, the blood inside, instead of being red, will be dark like this and thick. And the removal is difficult.
Wow.
So if such a thing should happen to you and you come more than 3 days, when I finish what I'm doing to you, I'll tell you that, young man, you will not have erection again.
Oh.
And it is so common everywhere. So, my dear friend, young men, aphrodisiac, yes, take. But be careful what you take. The women, God gave them eyelid. They shaved it and paint it. Fingernails, lips. Even if God can satisfy them, can you? So let's be careful. So this is one of the common problems of erectile dysfunction in this country. And the treatment is difficult.
And people say sugar, too much sugar to lead to erectile dysfunction for the man.
So too much sugar, not necessarily.
Okay.
Because now when we take food, we take sugar. In our pancreas, there is something we call beta cells. And these, their function is to produce insulin to break down whatever sugar we have and the body can use.
Okay, so the pancreas is another thing.
It's producing. So any amount of sugar you take, as long as your beta cells can produce insulin, there is no issue.
So can we say as long as you're not diabetic?
As long as you're not diabetic, you will not have problem of sugar affecting your erectile function.
Okay.
Unless, of course, in a very extreme cases, that you have what we call beta cell exhaustion. So the cell become exhausted and they cannot produce any more insulin.
Tired.
So sugar remain and you become more of a relative diabetic.
Okay.
You understand?
Okay.
So diabetic is one of the problems that causes erectile dysfunction.
Doc, is it true that tiger nuts and atadre too is like aphrodisiac, gives libido and all?
Yes, it gives.
It does, eh?
It gives.
How much should one take? Since they're natural, eh?
Well, that will depend on individuals. Because me, I will want my libido once a week because I'm busy.
Okay.
Another person might want it maybe 3 times. But you understand. So it depends.
Okay.
Another cause of erectile dysfunction is high blood pressure and its medications. Now, I want to say to my people in Ghana that erectile dysfunction could be a sign of a very terrible disease which is to come to you. Okay. So if this happened to you and you decide to go and see herbalist, you might be doing yourself a lot of bad. So what are the problems that can precede or that erectile dysfunction will show that they are coming. Diabetes is one. Immediately you think that your erection is not strong enough and madam is complaining, just quickly go and hide and see the doctor. And don't go to the doctor because our culture, we don't want to talk about erectile issues. Then you say your head. Then you say, okay, go to polyclinic. You say leg, polyclinic. Then when you are going out of the consulting room, then you say that doctor, the horsepower. Then I say, come and sit down. It's not everybody who wants to call you back. So let's talk about it. I mean, let's talk about it like the way we talk about headache. So hypertension. Diabetes.
Okay.
Serious heart problems.
Okay.
Can all lead into erectile dysfunction.
Can kidney problems also?
Kidney, not really.
Okay.
Liver, extended.
Okay.
People who take illegal drugs. Illegal drugs, we are talking about cocaine.
These days, tramol is there also part of it?
We won't go there.
We won't go there. Doc says we won't go there.
Yes, so even the treatment of hypertension, the drug itself, and the hypertension itself. So when it happens, please just go and visit. And I want to say that one thing which is common to all erectile problems is stress, anxiety, and relationship with your partner. These things should not happen. Smoking is not good. And we should try as much as possible to exercise, to keep our blood vessels open so that most of the time, all these problems will not come to us. Now, for the treatment of, let's call it erectile dysfunction, there are tablets that you can take, Viagra and other related ones. But before you take them, you should make sure that a doctor examines you and prescribe them to you. Now, people who have had prostate problems, they are either on treatment or they have surgery. They also have erectile dysfunctions, and these are difficult to treat. Now, these ones, including caused by diabetes, they are difficult. So there are other treatments which can be. Some will say surgery. In this case, there are two types. They can put malleable rods. They will screw it into the penis, one here, one here. So if you want to have sex, then you fold it, make it straight. Orgasm, everything will come. Then when you finish, you fold it and put back.
Hey.
Another set is they will put the rods, but they are tubes with like pipes.
Okay.
Then a pump will be here. When you press it
at the groin, lower parts.
around the pelvis area,
okay.
close to the bladder.
Okay.
Then when you press it like this, then it stands. You finish, you press,
it will
go down.
Wow.
Then there are another set which are medications. Some you take like a syringe. You fetch the medicine, then you push it into the penis.
Okay.
Like where the urine passes. Then after some time, you massage some more, then it will stand. But that one, sometimes, is only prostaglandin. It's not very good for a lot of people. But currently in this country, we also have another set where they will examine you, do everything, and decide the amount of medication you will need. They will give you an instrument which will help you give the injection yourself. That one, whether you like it or not, you have erection within 5 minutes.
Okay, so you have to wait
this
till
one,
5 minutes to.
Yes. Oh, but we'll be talking, then I say I'm coming. I'll go to the loo, I'll do the thing and come. Then I'll sit down and be waiting for you. And it helps a lot of people, especially those who have prostate cancer. They remove their prostate, damage the nerves and other things. It's also good. Then concerning the other aspects, especially the retrograde ejaculation, if you are a young couple, when you come, we will treat you.
Okay.
But if you are old, I won't waste my time on you. Then concerning the anejaculation, treatment must be sought. Because the block somewhere must be released for you to release the sperm. Then for the delay ejaculation, you have to change your behavior towards your wife.
It's about harmony.
It's about harmony. They're coming back to premature ejaculation. Now, whether we like it or not, we are humans. And everything that we do, as we grow, we do them better and better and better. The same thing applies to sexual acts. So those people who are very young, they start masturbating and other things. You know, our culture, we frown on masturbation. Is that not it?
Yes.
So when you are doing it, you want to quickly get your desire,
and stop.
Then you stop. Then you get used to the fast way of doing it. So it will be it. When you grow old now, you are used to that one, but there is treatment.
Okay.
Then recently developing is another form where they use the echo sound to break the blocks in the vessels to cause, but it has not reached us yet. So we will just have to mention
Dr.
it.
Paul Yegbe, once again, a renowned urologist, surgeon, naval captain of the Ghana Armed Forces, plus he speaks Russian. Thank you.
My pleasure.
Thank you so much for coming on Vodafone Healthline.
It pains my heart to tell a young man, 30 years,
Oh.
that you cannot have erection.
Oh. Well.
So we'll leave it at that.
Indeed, we have learned a lot. Muntu mubu, muntu mubu. We'll go for a break. We'll be right back.
My name is Dr. Patrick Banker. I'm a consultant neurosurgeon. And today I have a team of surgeons, anesthetists, and nurses who are going to undertake surgery in a 3-year-old. So we have a 3-year-old who has a tumor at the back of the head, and this tumor has eroded the bone, and it's lying on a very large vein that goes across the midline. And today, together with my team, what we intend to do is to remove the tumor, and there is a defect in the bone, and we want to repair the defect as well. This tumor is a very vascular, or to put it bluntly, it's a very bloody tumor. And for a 3-year-old, the whole blood volume is about 3 Fanta bottle volume. Okay, so if they lose a lot of blood, I mean, it can have very dire consequences on the outcome. Surgery will take about 3-4 hours because we need to be very meticulous. We need to repair the bone and then close the skin, and then send the child to the intensive care for the child to recuperate. By God's grace, surgery went very well. We were able to take virtually the entire tumor. There was a little bit of tumor that had actually infiltrated the dura, the covering of the brain, right over where the large blood vessel is. So it didn't make sense for us to remove that part that had infiltrated the dura. And we're able to cover the bony defect. And I think the cosmetic effect is also very good. So hopefully this child should recover very well. As I said, we'll get to know exactly what kind of tumor it is. And then based on that, there may be a need to give other treatments.
Well, hello viewers, you're welcome back. And my dream came true because I actually get to interview Nancy and her daughter Dinah. And I get to ask all those questions that we were discussing a bit earlier on. Okay, so Nancy Akwaba, Auntie Nancy, and in a buffet fair diner. When you say, wouldn't him say, Yamina bow pan no muhu, I didn't know when it no. And now force the same. Because as an ABC, no, you're fine, one.
I know, oh, no, you're fine. No, you're fine, pa. No, dear, go. And so I see, I know to me, dear, go. To me, dear, go. Time be an me,
Nancy, one more complaint be as a tea and a ya, a beer of fay near dear.
What to me, Bassin and tea and any ya.
And sana a born,
and
where she answer.
That time, no, no, dear, go.
Into modern hospital now, doctors in the catcher must say, Bibi, any one it him, then a course or why dream.
I didn't know, I am me. It means so much to me. I am to me. A hamika cry. Tambiano, me hammy, pa, or than so, no ton. Maybe Simon sent the idea we're calling a bed.
Only no be south, oh.
Let me say, I am betting I.
Come to I we person in the bone come up and me person me what she was thinking at the time by a danyamiasi. Yeah, danyamiasi. And also why are they? Say, or started yari in a modern hospital and tell me no more ye. No one when you be bro, what a sound because almost row before see a copaya quality into almost row. But Moody I could draw and if I how do you feel?
Say, dear, ye want to ye pa.
No, the Vodafone so I say me boy.
Oh, you don't want to say, oh, my. Aka nyomaka yomuti menye atambi ana Yesu
enna sika na wodi betua no
eni hokra
na me catch you
eni hokra
yo
ti bedamu ase
nti Auntie Nancy na me pese me hu say after your operation ni man no wo hwa wo ba no ni emu etisen ni ama oye etisen
oh otimi ye ni ama fine na ni dam so ni dam fo so omo ni agi nti say dey otimi ko school yi otimi ko asori fine na time kwa na person be ko asori na so say dey otimi ko asori bibia otimi ye hin na ye ni agi nti meda Vodafone access me damu ase enyame be hyiram na mo ko so ye dem ye no na enye
ye danyame ase ye da Vodafone so ase nti wa start school bi o mo hu
mpacho ya na sisi amama kwanti so mo bia obesanko
okay ene mo padi mi yan ka meti aigbe be se me ne bon komo pa na metie but me wade keto abi ma Vodafone fo wo ya no wa ye ni nyina apreko omo se yen fa we emma wo ene diner na mo fa mbo anfa hwe ne mane ahokeka no enkosi ye pepepe nti e di Vodafone fo si yen fa mam okay
me da mo ase nyame hyiram da mo ase
Ma, I'm for phone in your quick call and sawako.
Hey, it would have sukuta sound network way. I'm credit in the data fiano. Oh, Nichi, you don't know what so. Won't you say Vodafone? A double red 1, red 2, and red 5 offers. Yeah, double into swap up baby. Na 5 cities is any day. Jai. Uber Casa 250 minutes. Na data no. And also 250 megabytes. I hear na benya way. I guess a hand one.
Hey, mommy. And I said, me finish your call quick na call.
Hey, Apostle. Ube Jane. And yes, sir. Ube Bressa.
Switch to Vodafone and enjoy double into swap on red bundles of 1, 2, and 5 CDs. Enjoy double talk minutes to call all networks and double data to browse. Vodafone always gives you more. Terms and conditions apply.
Vodafone double into swap the guy.
The future is exciting. Ready?
Wow, Dr. Abba Paulson got a wish.
I did, didn't I? It was fantastic interviewing her, you know. Like I was saying, I wish I could speak every. But this really is what you call in medicine an incidentaloma.
Hey.
Incidentally discovered tumor. That's what it is. It's a real blessing. Yes.
Indeed, a blessing. Yes. And Dr. Yali, what was your highlight when it comes to the Mythbusters?
So coming to HIV and stigma. I mean, people with HIV are suffering a lot of stigmatization by virtue of the disease. let's ease up on ourselves. A hug here and there, a sweat over you, unlikely to transmit the infection.
So let one love, yeah?
No one love.
Let's stay safe.
Stay safe indeed, but I cannot let you go without giving you my special nutrition tip on libido. Watermelon and tiger nuts work like magic. Try to let us know. Let's keep the conversation going on our social media handles. And remember, this show was proudly brought to you by Vodafone. The future is exciting. Ready? Bye.
Until next time, bye.
The future is exciting. Ready?